This is Chew on Health, and I'm your host, Dr. Joe Chew, and I get to interview health experts in various fields to answer your most burning health-related questions. To submit yours, simply go to chewonhealth@gmail.com, and that is spelled CHIU on health@gmail.com. Let's get straight to today's question. All right, and welcome back. We have with us again Dr. Vitaly Mozeson. How are you doing, Doc?
Good. Another day in paradise.
Yeah, you ready for the next question here? It came
Absolutely.
in actually via email, and let's see. It says, Dr. Vitaly, what are the worst movements or actions for a spinal disc? So, what are some of the things that can actually hurt a spinal disc?
Yeah, that's another good question. One of the main things, the most common movement that hurts the spinal disc is when you bend and twist. So, for example, if you're picking something up that is to the side of you and your feet aren't facing it, but you decide to twist your torso and then bend and pick it up, that is the absolute worst movement. That movement alone could injure and herniate a disc. But a lot of the forward bending stuff, like when you reach down and touch your toes, especially the ballistic stretching where you're kind of bouncing and touching your toes, when you do that forward bending, what happens is you put a ton of pressure on the disc. And if you have a slight herniation, what it does is it can push that disc material back and create a bigger herniation. So when you do movements to decrease the disc herniation, it's always an extension. Those are called McKenzie exercises. So anything forward bending and twisting, sitting and twisting or bending, those are basically the worst movements. That alone can, like I said, injure a disc.
Okay. So it sounds like the majority of the disc pathologies, disc bulges, herniations are more in the posterior, the back portion of the disc.
Yes.
And it sounds like it's because of that forward bending motion pushing the disc, the nucleus, right, back, and thus rupturing it over time.
Yeah. And most commonly, like you mentioned, that inside of the material, the nucleus, which is the jelly portion of the disc, that will herniate back into the side. It can herniate forward, but in most cases, like you mentioned, it does herniate back.
Just a follow-up question. What about sitting? Is that, I know that's not a movement, but how's that?
Yeah, sitting is definitely putting pressure on your disc. You take your legs out of the equation, and it's basically, all the pressure on your low back disc. So everybody has to sit. Most jobs entail sitting at a workstation. But if you have to sit, what I would recommend is that you get up every 35, 40 minutes. And I'm not talking about for 20 minutes, but just go walk around for a couple minutes, get a drink of water, just get out of that position just for a few minutes. And you'll save yourself, a lot of stress that can accumulate on that disc, just that alone.
Great. Well, that's another nugget. So some more great advice, and thank you so much, Doc. And until next time.
Got it. Next time. See you later, Joe.
Thank you for listening to Chew on Health. To get your question answered, email us at chewonhealth@gmail.com. And to find out more about our health expert, go to the show notes, or you can visit us at chewonhealth.com. And until next time, cheers to your health and wellness.